A recent study analyzing maternal mortality rates shows pregnancy-related deaths surged in the U.S. by nearly 30% during a 5-year period ending in 2022. In tonight's In Depth, CBS's Elise Preston reports recent federal research funding cuts could hamper reversing this often preventable crisis.
The sound of sweet coos echo in this postpartum checkup class at Los Angeles Birthing Center Kindred Space LA. Amina Falah soaks in every moment with her 2-month-old baby girl, Zaria.
I feel very blessed to have had this experience. Like, the first thing I did when my daughter came out here was I thanked God.
A healthy birth after undergoing what Falah described as a traumatic delivery with her first child nearly 4 years ago. She was diagnosed with preeclampsia, a life-threatening complication, and underwent a C-section 9 weeks early.
By the time they did catch it, it was too late, and I went straight to the hospital.
What's going through your mind when they say your blood pressure's too high, we need to admit you?
We were definitely scared. It's a major abdominal surgery that I did not mentally prepare myself for, that I didn't do research for.
Research shows Black women disproportionately undergo C-sections, increasing the risk of complications like internal bleeding, blood clots, and infection that are also often diagnosed late or sometimes ignored altogether.
None of the nurses looked like me, but at the end of the day, regardless of what I looked like, I just wanted to be heard. Birthing is hard, but the least you want to worry about is dying when you're giving birth.
The U.S. has the worst maternal mortality rate of developed countries, and new numbers show Black women are 3.5 times more likely to die than white women from childbirth and other pregnancy-related causes.
The racial gap widened.
It went down for other folks, but went up for Black women. It's unacceptable.
And preventable.
Allegra Hill and Kimberly Durden opened this birthing center in 2020, where mothers, mostly of color, with low health risks have access to care.
Because of other things like structural racism and just like the level of like stress we carry as Black people in America, we're kind of like, the cracks are bigger.
Our community doesn't have time to wait, so that if folks can get to us, we can take care of them, and we don't have to wait until the system gets fixed.
Just this month, federal cuts at the CDC impacted research and programs dealing with maternal mortality.
Don't move your body.
Despite the challenges,
My hope is that this work that we're doing lives beyond our lifetimes.
the midwives are determined to continue their work, combating a health crisis with help and hope. Elise Preston, CBS News, Los Angeles.